Welcome back to Great Day. Whether you have dentures that you hate or you lose a tooth, you need a replacement, and mini dental implants are a great option to get your smile back looking great. Dr. Jordan Spencer rejoins us today from Troy Family Dental. Always a pleasure to see him, and Dr. Boatman too. Give our best to Dr. Boatman.
I will.
Great practice up there. If you're not familiar with it, I'm going to give you the phone numbers and the addresses and all that a little bit later. A big part of the practice up there is mini dental implants. So we've talked about these before, but I don't like to take anything for granted in case somebody's not familiar with it, or maybe they've heard the term and they don't exactly understand what it is. What is it?
A mini implant is a much smaller implant, less invasive, less expensive, and it can be placed in a lot of areas where a traditional implant can't be placed because of bone loss. So if there's less bone, we can still most of the time use one.
Which is an issue sometimes for some people, especially maybe older adults.
Yeah, correct. As you lose teeth over time, you lose bone. The bone dissolves away, and it makes it harder and harder to get implants.
Okay, so you spend less time putting them in. That makes them less expensive. They're less invasive. We heal quicker. All positives, right?
Yeah.
So let's talk about some of the applications.
Yeah, so the most common application is to use it for a lower denture and an upper denture. But for a lower denture, they move around quite a bit, and you have to use a lot of glue and goop, and it's just a pain. So what we do is we can put 4 mini implants into the bottom jaw. It's not painful at all. You're completely numb or sedated. And then you put attachments into the denture, and then your denture can just snap right in. And that's it. You can use your existing denture too if you like your existing denture, or you can get a new one.
And you can carve away some of the old base to your dentures and make a little room, which is particularly helpful on the uppers.
Right, correct. The upper one, we can actually have no palate anymore, so you don't have to have that up in the roof of your mouth where you have that thick feeling up in the palate. You have about 10,000 taste buds in your mouth, and you lose a lot when your palate's covered. People don't believe that, but it is. So on the upper, we put mini implants, and then we hollow out the palate and snaps in like that, and
bada bing, bada boom.
Yeah, so it's awesome.
You mentioned sedation. That's a big part of the practice too, because there are some people that just, for whatever reason, they just can't deal with somebody working in their mouth.
Bad experiences when they're a kid.
That too,
lots of things that cause people to be nervous about getting teeth done. And we do every procedure: root canals, wisdom teeth, crown and bridge. We do all that. So people will come in and we'll sedate them and get all their work done in one visit, and they remember very little about it.
What can be better than falling asleep and waking up and it's done and you're out the door, right?
Yeah.
And a very friendly staff, I might add, as well. So thank you, Dr. Spencer.
Thank you for having me.
It's always a pleasure to see you. To make an appointment at Troy Family Dental, call them, and I want you to write this down: 618-477-8421. And you can also find them on the web at troyfamilydental.com.